I am a registered nurse. I went to nursing school. I went to a bachelor's degree program, so it took me 4.5 years. And I have done some education and gotten a lot of certifications since then, and here we are. Once I felt like I had my feet underneath me, I transferred to a level 1 shock trauma center. I've learned so much ever since. Shock trauma is any sort of incident, whether it be a car accident, whether it be, God forbid, a suicide attempt or a gunshot wound or stabbing, anything that is traumatic that can happen to you, you are brought to a specialized emergency department. There are 3 different levels. There's 3, 2, and 1. 1 is the highest level of care. It means all of the surgeons are always in the building to take care of you, whether it be neurosurgeon, whether it be cardiothoracic surgeon, whatever kind of specialty you need, they're in-house in the hospital. When I went into this field, I knew that it was going to be intense. I knew that my decisions would matter. However, I didn't realize how my decisions actually mattered. Yes, there is a doctor calling the shots. However, the doctor is not with the patient, but maybe 10 minutes out of every 3 hours. It is the nurse's responsibility to recognize changes in that patient, and it's the nurse's responsibility to act on those changes. We get a call on the radio that there is a young boy coming in unresponsive. Normally we get a little bit more of a report than that, but you could tell that the emergency personnel was a little bit frazzled. So we didn't question them, and because they said that the patient was unresponsive, it met shock trauma 1 criteria. And so when all those doctors come in the door and this young boy comes in, you can obviously tell that it's not going to be a good outlook. He went through the windshield head first. And so once he was intubated and we were able to stabilize him and he got a couple units of blood, we went to the CAT scan, and what the CAT scan showed was shocking. He was something called internally decapitated, which is very rare. It essentially means that your head is no longer connected to your spine. Once the neurosurgeon reviewed the case, he actually told us that he was also something called locked in, and that's even more rare. So essentially what that means is you're conscious, but you're unable to blink your eyes. You're unable to talk. You're unable to move. So you have everything, you know everything that's going on, but you're essentially paralyzed. Even though that was devastating to find out for this young boy and his family, that wasn't what bothered me. What bothered me was the part where we had to drill into his skull to measure the pressure inside of his brain, but we didn't use sedation because we didn't know that he was still with us. That poor boy felt all that pain and we didn't know it. That part really bothered me. I've taken that in my career and I have made it to where even if someone's unconscious, even if someone, may not appear to be all there with you, it doesn't matter. You still need pain medicine, you still need sedation. Any sort of case where anything is traumatic, you think about it later. But when it's a kid, it hits different. I know the adult dosages off the top of my head for whatever medicine I'm giving, but I always double and triple check myself with pediatrics. It's just, being a mom, I think about what if those were my kids? They've got so much life left to live, and now they're going through this traumatic accident that's going to change their life, whether it be physically or mentally, it's going to change their life. And how I respond to that, to this child going through this incident, will help play a role in how okay they are for the rest of their life. I remember everything. I remember his curly hair. I remember his mom's cries as she laid across his chest. I remember he was 16 and he had a girlfriend and she couldn't even go see him because she was so upset. I remember his name. I remember what he was wearing. I remember everything. Unfortunately, being in the shock trauma emergency room, we're typically only with the patients for about 7 hours and then they get transferred to the trauma ICU. However, patients like him I follow up with, those units were connected. So it was easy just to walk across the door and just poke my head in and see how he was doing, but he eventually passed. Going home after a particularly tough shift, I kind of have a routine. I'll sit in my car for about 10 minutes in silence, pray for the family. I just take some deep breaths and I try my hardest not to bring it inside. I don't want to bring it into my husband. I don't want to bring it into my kids. Sometimes I'll go in if it was a particularly bloody day. I'll leave my scrubs at the door and I'll just go straight to shower. And that's a really great way to decompress. But my favorite thing to do is just hug my family when I come home after a hard day. There's certain places, like we have this overpass. I can't drive by that overpass anymore because I took care of a patient who jumped off. It's a good 200 feet up in the air, and when he was brought to us, he was in cardiac arrest. There wasn't a bone in his body that wasn't broken. Being around my city, I'm like, oh, I see that. I remember that patient that jumped off that overpass, or I know someone who was shot at that gas station. I'm not gonna stop there. Living in the city where everything happens, it definitely affects how I live. To be a shock trauma nurse, you have to have thick skin. When you're taking care of a critical patient, you know, everyone's blood pressure is gonna be a little higher than normal. Everyone is gonna feel the intensity in the room. Sometimes the way that people cope with stress is by screaming. You're gonna get screamed at. Sometimes people just stay silent. And you have to know that's not me. You know, you don't have a problem with me. That's just your way of coping. The way that I cope is I strive under pressure. I do my best when I'm forced to do my best. I have once been a nurse for a responding mass shooting. It was a very slow day. We were about to send people home, actually. Then I get a call from my mom and she asked me, where are you? I'm at work, what do you mean? And she said, well, thank God, because there's a shooting at our local grocery store. And I was there the day before work. Unfortunately, it was an employee that was disgruntled and he decided to shoot, I believe it was 8 people in that grocery store. At the time, we had reports that it was 16 or 20 people. They weren't quite sure. So we activated our mass casualty response within the hospital, which is essentially different people in different areas. First you get triaged, then determining on the triage of how sick you are, you either go here or you go there. So it's about 50 people that respond. I know a lot of nurses that came in on their days off to help. The situation was very grim. It was everyone just trying to put their best foot forward and do the best for these patients. However, this is where we live. So even though we're trying to take care of other patients, we're trying to call our own loved ones to make sure that, hey, are you there? Are you safe? Yes, our priority is the people that are rolling in the door. However, you're bringing it more home to try and say, like, are you safe? Once I finally realized that we were gonna have a large influx of patients, I kind of just stepped away for a second and I took a deep breath, because this was only like my 3rd month in this particular unit. I hadn't really seen anything of this sort quite yet. Maybe one gunshot patient here, one there, but I haven't seen patients who had 30 bullets in them. I just took a deep breath and I said, where do you need me? And where I was the runner, which essentially what a runner is a person that does whatever the primary nurse needs for 3 different patients at a time. So whether this patient needs blood, I'm gonna go get blood for this patient. Or if this person is having a hard time getting an IV, I'm gonna get an IV on this person. So whatever the needs are for those 3 different rooms running at the same time, I will respond to those needs. I remember there was a particularly elderly gentleman and he came in and his systolic was in the 50s. He was about to pass. He wasn't even in the system yet because EMS had forgotten to call a report because they were so frantic. When you're not in the system, we can't pull blood on you. We can't give you blood. And that is what this man needed, was blood in order to save his life. I just remember emergency overriding this blood saying, hope that's okay, because I'm gonna give it to them to save his life. That day I had never seen that much blood on the floor. I had to throw away my shoes. There was chaos. People screaming, just tears everywhere. Everyone was on the phone trying to call their loved ones to make sure that they're okay. There were people who actually just completely shut down, which is understandable. You need your friends, your work friends. I believe that healthcare workers have a gift for disassociating. When I go through a particularly traumatic experience with a certain kind of patient, I don't really think about what it's going to be like for them until the next day or possibly a week later. So in the moment, I tend to thrive under the pressure. I get it done what needs to get done. It's going to be later when I'm laying in bed and trying to sleep that I'm thinking about what's particularly going to happen to this patient for the rest of their life. I get a lot of nightmares. I see my family in the same instances of what happens to my patients. Particularly, I always get told, like, my family is safe, I am safe. That helps me go to sleep. The best thing that I do is I listen to a book on tape, which I know sounds crazy, in order to fall asleep, because I've done so many traumatic things where turning my own thoughts off just isn't possible. I have one where, like, an old man was stabbed by his wife. She was schizophrenic. As he was passing, he said, "I forgive her and it's not her fault." Even when he was dying, he still had enough love for his wife where he didn't blame her for stabbing. In that moment, he had so much forgiveness and so much love for her that it didn't matter what she did. And he knew that it wasn't her fault and that it was just her mental illness. Being at a level 1 trauma center, majority of the patients pass. Because that is the worst of the worst, you know? That's where the worst people come. I believe our mental health crisis needs a lot of work. And I believe that some people are in the wrong place at the wrong time. However, sometimes they're not. But unfortunately, I do not know when they get to me. A lot of times when people come in, like, I don't even bother asking them their story anymore. I have taken care of murderers. I've taken care of someone who murdered 14 people. Even though that was horrible in my mind, you know, I had to give him the same amount of respect that I would have given anyone else, because at the end of the day, that's my patient. I was not even working at the trauma center. There was a girl who walked in completely naked, and she was missing on her arm, her elbow down. And she reported that she was on a date. She'd never met this boy before. She woke up in the woods alone with her arm chopped off. She never knew. They never found the man. She never knew why they did it. Still to this day, 6 years later, I wonder what he wanted with her arm. I don't know if it was a trophy. I don't know. His intent was not to kill her. All he wanted was her arm. If someone is missing any sort of limb, reattaching them most of the time is not the option. Unfortunately, you're just going to have an amputated limb. You'll go immediately to surgery and they'll do their best to save what's there. When she came in, she was in shock. She wasn't crying. She wasn't scared. It was just a blank face. I don't think the reality hit her yet that this is going to affect the rest of her life. I feel like days that I've particularly have gotten upset are incidents that involve children. Say mom and dad didn't put the child in a car seat, didn't put them in their seatbelt, and they got in a car accident. That child was, I've had one where a child died. I've had one where they had severe internal bleeding, and that could have been prevented just by one small act of putting him in a car seat and putting a seatbelt on. I do my best to compartmentalize that and still give them great care and still be there for the grieving parents. There have been plenty of shifts after work where I have just sat in my car, either a tear rolled down my cheek or I just screamed in frustration. No one's ever seen me do it. I want to appear strong and that I have no problem doing it again the next day. When you get to see a patient walk out that you don't think was going to be able to walk out of that hospital, and you say, I played a role in that. It's even better when the patients come back a year later and visit you in the hospital and they remember you and they say, hey, you were the nurse that took care of me right when I came in here. I remember looking up and seeing your face. I appreciate you. In those moments when patients come back or you get to see them walk out of the hospital, it is gratifying knowing that I helped play a part in making them better. I will 100% say I am not perfect. You know, sometimes they're screaming outside my door and I have to shut the door just for a minute to take a breath. I have realized that majority of victims are made a victim by someone that they love, which is heartbreaking. You're not just walking down the street and you get shot. Unfortunately, a lot of times it's your best friend, it's your spouse, it's your family member. I've heard a lot of regrets as people have died. I wish I did that day, or I wish I told her that I loved her. Hearing all of these last words from these people that they've lived it, you know, they know everything. It has made me realize that you only live once is not just a slogan. You only have the opportunity to do these things once. So love the fullest that you can. Appreciate the little moments. Just appreciate the beauty of the world around you, because it's not going to be there someday.